You know you may actually have a heart attack and die because of COVID-19. But here's how to avoid it. Let's look at a study done by Yin Zhang, Tony Ma, Jin Ying Yang, and Zhang Ji. Whoa, I never knew I could actually say those things. Those lovely words, those lovely names. But these actually were academics who looked at, well, various happenings that were going on in Wuhan, China in late 2019 and early 2020. Now I know there's a lot of things said about the coronavirus, but it's timely. We need to be on top of this. Now they wrote a paper in early 2020 and it was entitled COVID-19 and the Cardiovascular System. And it was really, really interesting. If you know anybody that actually has heart problems in the past, or even if you're intrigued yourself, this is the one for you. We need to avoid all those issues if we can. So in December 2019, they recorded the fact that there was an outbreak of pneumonia caused by this hugely novel coronavirus. And of course, we all know it now as happening in Wuhan, Hubei province in China. It spread rapidly throughout China, and they began to realize pretty soon that there's this risk of an actual pandemic. By late January, the end of January in fact, the World Health Organization in late January, early February 2020 declared this outbreak of SARS-CoV-2. And this was a hugely, well, a health emergency, a public health emergency of epidemic proportions. Even compared with SARS-CoV, that is, that caused an outbreak of SARS back in 2003. This huge one, SARS-CoV-2, was, well, it was just knocking it out of the tree because it had a stronger transmission capacity. So this is why this particular study was looked at, and all different studies within it were looked at. Some patients back then, that's only a couple of months prior to the recording of this video, well, they felt that their underlying heart issues or cardiovascular diseases might actually have increased their risk of death. In fact, the medics found out that this was true. They understood at the time that this, well, particular virus was doing what it was doing rapidly, but they didn't realize until they started looking back on those people in Wuhan and those that had actually died and done the statistics that, well, there was an underlying problem with those that had cardiovascular issues because they were more likely to be infected and have worse, well, become in a worse condition with this COVID-19 linked in with their heart disease problems. What they found from the study was that patients with hypertension or those that actually had issues with their heart were going to be more, well, pronounced in the pain and in the breathing category, and the overall survival rate was lower with these people. They found that those that actually had acute cardiac injury were more likely to have heart failure in the end with this particular COVID-19. And this happened in 5 of the first 41 patients that were diagnosed with COVID-19 in Wuhan, China. Within the study, 4 of the 5 patients, that's 80%, who had myocardial injury were actually admitted into the intensive care unit. And this showed the seriousness of the nature of having the myocardial injury in patients who actually then contracted COVID-19. So they found that patients presenting with heart palpitations and chest tightness, rather than just breathing or respiratory symptoms like coughs or fevers, were actually getting in troubled waters and, well, dying with COVID-19. This was not reported all around the world because after Wuhan, China had experienced this COVID-19, this horrible disease that was spreading like wildfire, the facts were we were told about respiratory issues and fevers and coughs, but it was actually heart palpitations and tightness that were just as bad for people who were linked with COVID-19 and contracted COVID-19 in fact. This was actually pushing them closer to death. Among the people who died from COVID-19 in Wuhan, China at the start, there were reports that almost 12% or 11.8% in fact of patients had underlying CVD or heart damage. This elevated the chances of getting, cardiac arrest even when they were hospitalized. In one study, the researchers found that among the patients with severe symptoms of COVID-19, almost 60% had hypertension, a quarter had actual heart disease, and 44% had, other cardiovascular issues. So you can actually see where the links with heart disease and contracting COVID-19 were proven in the early days, the early hours, the early weeks of the outbreak in Wuhan, China. So the conclusion of this study was that essentially, if a person had heart disease or heart issues, hypertension and so on, they were just as likely to have problems as those that have respiratory problems too. So what can you do about your own heart? What can you do about the people around you who may have heart issues? You might be young. You might think, hey, I just don't really need this particular information. It's not going to help me. But remember, people that are younger often have a heart attack too. And in fact, stressful times has been shown to really elevate the problems with people that ordinarily wouldn't really have heart issues. People can get heart problems and palpitations during these stressful times, so we need to prevent ourselves as best we can. So how can we do this? Let's look at the heart's electrical system briefly. We have a heart rate of something between 60 and 100 beats per minute. And our heart rate, which is really the number of times that our heart beat per minute, has a particular rhythm. And this is synchronized, with the pumping action within our 4 heart chambers. And within all of that, there's this electrical system. This is coordinated with the orderly contraction of a person's atria and ventricles. And this is what's referred to as the sinus rhythm. The electrical system of the heart, this is controlled by the timing of the heartbeat and the sending out of electrical signals throughout the cells. The heartbeat happens when first the SA node, or the pacemaker of the heart, sends out electrical impulse. This is followed by the upper heart chambers, or the atria, contracting. The AV node then sends this impulse into the ventricles. The lower heart rate chambers, or the ventricles, contract or actually pump before the SA node then begins to send another type of signal to the atria to contract, which starts the cycle all over again. This is why we feel ourselves, with our heart beating. So what can we do to help ourselves and others during COVID-19 and our hearts especially? Well, we can get active. Now I know it's not easy to get outside, and it's tricky if you're in a tight apartment block. But if you actually have stairs, you can do up to 30 minutes of cardiovascular work on your stairs. What is cardiovascular? Well, it's the vascular of the heart, that cardio piece. So it's exercise. It's when your heart pumps like it's never pumped before. Going up the stairs is a really good idea, because from the first step right up to the 10th or last step, basically your heart is pumping blood further and faster than it has done in resting state. If you can do 30 minutes a day, then you're really going to help yourself. Now, of course, going up and down the stairs for 30 minutes a day is hard work. And not to mention just on your stairs, but anybody even just watching you, not to mention you yourself. But if we can get outside and just move a little bit, or even get into our kitchen, walk around it, it really helps just our hearts increase that heartbeat, to get it up high so that we can increase the amount of activity we're doing on any given day. As well as being active, we need to stop and avoid cigarettes. Cigarettes just create heart disease. Full stop. We need to stay away from smoky areas and places that have those smoke-filled areas, because they're just putting more stress on our heart. And then at times of real stress and pressure, our heart really finds it difficult to actually, react to this, because it's already under pressure. They're really good for our heart as well. Be wary of processed foods or salty foods. We have time now to actually reflect on things and try to take our time and learn how to cook. Why not? This is the time we can actually do it. We're trying to maintain, of course, a healthy weight. That's not easy at times. If you can change your eating and, eat clever and also exercise sensibly, then you're going to be in a much healthier BMI area for your height and weight.